So I'm Kerri Johannson. I'm a pulmonary physician and I specialize in interstitial lung disease, and I'm a clinical associate professor of medicine and community health sciences at the University of Calgary. ILD stands for interstitial lung disease, and the interstitium is an important part of the lung. So I think of the lungs like trees. So you've got your trunk and then your main branches, and those are the airways. But the interstitium is really where the leaves are, and that's where really important stuff takes place in the lungs. So growth and repair, but also gas exchange. So how you get oxygen into the bloodstream and then drop off carbon dioxide. And the interstitium can get inflamed or scarred, and then it becomes what we call an ILD, or an interstitial lung disease. So there's some forms of interstitial lung disease that are clearly caused by exposures. So there's smoking-related lung disease, there's asbestos-related lung disease, so certain things in the environment that you'd be breathing in. And then there's other forms of ILD that we think happen in a genetically predisposed person. So there's some sort of predisposition for getting this. And then there might be some environmental or inhaled exposures along the way, whether that's work-related exposures, viral infections, smoking. The main symptoms of interstitial lung disease would be cough and breathlessness. And I think it's really important that people know that breathlessness isn't a common sign of aging. That's not a normal manifestation of us just getting older, and so something not to ignore. And if you notice it, you should get it checked out. So ILD can do two things. So it can cause inflammation and it can cause scarring. And I think of inflammation like if you had a cut on your skin. When it first happens, it's like a red and swollen and itchy. That's inflammation. And then after it heals, there's scar tissue there. And unfortunately, once the scar tissue is laid down, we can't get rid of the scar tissue. We are trying to identify as many preventative options as we can, obviously because ILDs are so devastating and without a cure. To treat and manage ILD, we've got the pharmacologic interventions and then the non-pharmacologic. So from the pharmacologic, there's the medications. In the non-pharmacologic management category, those are really important things like exercise, regular physical activity, supplemental oxygen if people need it, so either at rest or with activity, infection prevention, supportive care, education, and palliative care, so also helping manage people's symptoms as things progress and especially towards the end of life. The best way for patients to manage their ILD would really be to work with their clinic and to work with their clinic teams. I think there's a lot of education and support opportunities to get involved in. And if you can, where you are getting your care, see if there's a research program. So we're doing a lot of clinical research to better understand why people get these diseases, how best to manage them, and how they impact people's lives.